Hi, my name is Erin Tennant. I'm here to talk to you today about liver disease. How many of you have heard of cirrhosis of the liver? How about hepatitis? Well, I'm here to tell you I've dealt with this on a personal level. Here pictured is my mom, intubated on a ventilator, dying of liver disease. As I was taking care of her for a month's rehab, I realized how many people were not knowledgeable on how prevalent this is in the United States. According to the CDC, from 2000 to 2015, death rates went up by 31% from liver disease and cirrhosis. In fact, the state of Florida is the 10th leading cause of death, and it is in most of the top 10s in the remainder of the states. Today I'm here to discuss with you what exactly is the liver, what the liver's functions are in the body, and what symptoms you can get from the liver disease, and then how could they possibly be prevented? Is there testing? Is there anything that could stop this from happening to you or a family member? What is the liver? The liver serves many purposes. It filters the blood, it gets rid of toxins, and it aids in digestion. More so, the important parts of the liver are albumin production, which is a protein that carries fluid into the bloodstream instead of going outside in spaces that it doesn't belong. That causes swelling, which we'll get to. Bile production is a fluid that helps digest fats. It filters the blood, that's toxins, drugs, alcohol. It regulates blood clotting. It resists infections. It stores vitamins and minerals. And it also processes glucose and makes it into glycogen so we can use it later for energy stores. What are some causes of liver disease? Now that we know how the liver functions, what happens to it to get progressed to a disease process or a disease state? Well, infections like hepatitis A, B, and C. What are the differences between A, B, and C? Well, there are more than A, B, and C hepatitis, but the three main common ones are A, B, and C. A being a foodborne, B being a sexually transmitted disease, and C is blood-to-blood contact. So that would be like a nurse poking someone with a needle and then poking herself. Autoimmune diseases, Wilson's disease, lupus, those can cause cirrhosis. Cancers and cancer treatments. Alcohol abuse from chronic inflammation of the organ, toxins, and then genetics. So if you have a genetic component, you need to think that you might want to keep looking into this early on for preventative measures. So now you have the disease. So according to Mayo Clinic, these are some signs to look out for, and sometimes there are no symptoms at all in the beginning. So if you notice yellowing eyes or skin, sometimes the skin doesn't look completely yellow. On advanced disease, it looks more tan. And then you have the swelling, the abdominal swelling here and in the legs and hands and ankles, dark color urine, pale color stool, loss of appetite, and nausea and vomiting, which nausea and vomiting are a common sign in most organ failures. So how do we prevent this disease from happening? Well, you want to avoid drugs and alcohol, or at least do your minimal alcohol. I know it's hard when we're out and hanging with friends, but we can minimize it. Exercise regularly, eat healthy foods, watch excessive fats, practice safe sex, and vaccinate against hepatitis A and B. C does have a treatment. I know you've seen that on the TV programs. However, hepatitis C has to be a certain one to be treated with that. There are also side effects to that drug as well. So lifestyle changes like weight loss are a huge deal because obesity is hand in hand with liver disease, and that causes what's called a fatty infiltration or fatty liver disease. And once that fat infiltration gets on those visceral organs, it tends to make them stiff. So no drinking, weight loss, immunosuppressants if you have an autoimmune disease. Now I know people are like, well, what tests could we take at the doctor to know for sure if you have this or not? Well, blood work. Early on, your blood work has elevated AST and ALTs, which are your liver enzymes that are within your blood. Later, when you're in failure, those become normal values, but you'll have other symptoms along with that. Imaging like CT scan and MRIs, they can show exactly how the liver is functioning. And then the conclusive is a punch biopsy, which they go through and take a piece of the liver and test that for the end-stage disease. So now that you understand how the liver works and the process of the liver, I hope you enjoyed my speech today. I'm going to end with a quote by saying, organ donation is not a tragedy, but it can be a beautiful light in the midst of one. Donate organs if you can. It does save lives, and I appreciate your time here, and I hope to talk to you guys soon. Thank you.